Hello everyone, my name is Vivian Alman, and this is my CapStone project. It is on AIDS and genetic engineering. Topics of discussion will be what is AIDS, the history of AIDS, what is genetic engineering as a treatment for AIDS, and the ethics surrounding genetic engineering. Firstly, what is AIDS? AIDS, or acquired immunodeficiency syndrome, is a virus that gets into the bloodstream and attacks the immune system and weakens it. It is the late stage of HIV, or the human immunodeficiency virus. It is transmitted through sexual intercourse, the spread of body fluids, needles, breastfeeding, organ transplant, and blood transfusions. It is, however, not transmitted through kissing, mosquitoes, towels, toilets, and sharing food. How does AIDS affect the body? There are 3 stages of HIV. The first stage is acute HIV. The amount of the virus in the bloodstream is very high. There's a high transmission rate, the immune system is being destroyed rapidly, and the body is very sick with flu-like symptoms. The second stage is chronic HIV. The virus is still multiplying, but at a much lower rate, and the body is not as sick. AIDS is the final stage. The immune system is very weak, the body is very sick, and death can occur. The symptoms of HIV are fevers, sores, spots on the body, swollen lymph nodes, weight loss, headaches, diarrhea, muscle pains, all things that can be mistaken for flu or other sicknesses. Next is the history of AIDS. It was first seen in 1981 in 5 gay men, all presenting similar symptoms to lung infections, but some of the symptoms threw doctors off because they didn't usually go with lung infections. Before a report could be made, 2 of the men passed away and the other 3 followed shortly afterwards. AIDS was officially named in 1982 and was declared an epidemic. In 1983, HIV was discovered, and this allowed for treatments to begin getting created because we could identify it on a molecular level and identify what family it belonged to. Zidovudine was the first approved treatment for AIDS, and it was approved in 1987, but it developed a lot of drug resistance and often had to be paired with other drugs to work. The turning point in treatment came with highly active antiretroviral therapy, or HAART, in 1995. This combination drug therapy consisted of 6 classes of drugs that all worked together to stop cell replication at a certain point. It increased the survival rate to up to 81%, and people could live 10 years longer. The current treatment is antiretroviral therapy, or ART. It is essentially the updated version of HAART. It uses the same idea of a combination drug, but it only uses 2 to 3 drugs. Unfortunately, with AIDS being first seen in gay men, it became perceived as the gay disease, and there was a rampant uptake in homophobia and hatred towards the LGBTQ community that still exists to this day, and that stigma around AIDS and gay men still exists. There was also the fear of touching people with AIDS. Due to the amount of misinformation that was being spread, people believed that simple touch could spread the disease. One of the best examples of somebody breaking the stereotype was Princess Diana hugging children in hospitals with AIDS and shaking hands with patients. It also caused a rise in the fear of needles that still exists to this day. I remember being told as a child to stay away from loose needles on the ground because I would get AIDS. Thankfully, today there are a few methods to stopping the spread of AIDS, the best being condoms. They are the most effective barrier method with a 98% success rate. Another method for preventing AIDS is pre exposure prophylaxis, or PrEP, which prevents HIV from getting in the body before any sexual intercourse happens. It is a prescription drug that is taken every day. There is also post exposure prophylaxis, or PEP, that helps stop HIV from taking hold in the body. If you are exposed to HIV, this can be taken and the risk of getting it lowers significantly. Unfortunately, AIDS is still a global issue. There are 40 million cases globally, with Africa being the most affected continent. 1 in 30 adults are infected. Cures are needed, and this will transition us into the second part of this presentation, genetic engineering being used as a treatment. So, what is genetic engineering? Gene editing, or genetic engineering, is when technology is used to edit a DNA sequence. Genes can be taken out and added, or taken out and edited and put back, or just taken out entirely. CRISPR is the latest and greatest technology, and it acts like scissors on a sequence. It can be used to cut and add things to one. AIDS and other diseases like it come from mutations, which are mistakes in DNA coding and sequencing. There are 3 types of mutations. There are good mutations, bad mutations, and neutral mutations. Good mutations benefit an organism. For example, bacteria that develop a resistance to antibiotics are able to thrive even when threatened by them. Neutral mutations, as the name suggests, are neutral. They don't affect an organism at all. Bad mutations are mutations that affect an organism negatively. Cancer, for example, is a bad mutation. These mutations are what are often most targeted by gene editing. And there are 2 types of gene editing. The first type of editing is somatic editing, which involves editing stem cells, which are any cell except your gametes, which can be used for anything. These edits are individual specific, and they cannot be passed on to offspring. The second type of editing is germline editing, which includes editing your gametes, which are your sex cells, and these edits can be passed on, and these affect the entire body. So how can genetic engineering be used as a treatment for AIDS? CRISPR is the technology being looked at for AIDS treatment. In trials, cells within bone marrow have been edited and put back into the body, and the person who got the transplant was functionally cured of HIV. It was not eradicated from the body, but they could live normally. In 2024, it was used to target genes that cause HIV in the blood. In one person, their blood cleared after 6 months. It didn't work for everyone in the trial, but it was a step in the right direction. It has also shown hope in preclinical trials by being able to turn off the genes that cause AIDS and fighting the resistance that comes from the virus. Unfortunately, there are a lot of ethical issues surrounding gene editing. It is a fierce debate currently in the scientific community whether gene editing should be used in people or not. The people for it argue that it can be used to eradicate diseases, create healthier populations, allow the human species to evolve quicker, children can live disease-free, and medicine costs can be cut because a disease would be eradicated. The people against it argue that it is playing God and that scientists are messing with things that they shouldn't, and they know too little about the human genome to be editing it. People also worry that the genes edited within sex cells will be passed down to the entire species. So, in conclusion, AIDS is still a relatively young disease. It's only been around for 40 years and is very much still in living memory. Unfortunately, the stigma it created still runs very deep and affects the LGBTQ plus community specifically very much today. It should not be looked at as a gay disease because anyone can get it, and treatment should be accessible to everyone. That is why I personally believe that gene editing is the best future option. It can eradicate it entirely, and gene editing is not a bad thing. The advancements that can come from it and the cures that can come from it outweigh the cons. I wanted to end this presentation with a picture of Freddie Mercury, who really first introduced me to AIDS. His story was really my first time hearing it, and he's a big inspiration for me. Also, if you are wondering what the red ribbon that made a constant appearance was, that is the symbol for AIDS awareness, and December is AIDS Awareness Month. So thank you for watching, and I hope you learned something about AIDS, gene editing, or both.